Solution-Focused Brief Therapy by Linda Addison for MFT 619 Group Counseling, Module 6, Discussion 2. Solution-Focused Therapy, developed in the 70s by Steve DeShazer and Insoo Kim Berg. This modality was formed to reduce the focus on the why and instead emphasize the how of treating patients and clients. This model minimizes emphasis on past failings and problems and focuses on clients' strengths and previous successes. Works from the client's understandings of their concern, situation, and what they want different. This modality, the client is seen as the expert and does more of the talking. The therapist takes a back seat while the client is behind the wheel. The main principles of SFBT are: 1. That it is solution-based rather than problem-solving. It has a therapeutic focus on the client's desired future, not on their past problems or issues. Clients are encouraged to increase useful behaviors, alternatives to current undesired patterns of behavior, cognition within the client's repertoire. This model assumes that solution behaviors already exist for the client. Small increments of change lead to large increments of change. The therapeutic process. In solution-focused interviews, signature questions are used to set up a therapeutic process in which they listen to what clients say and absorb what they mean. SFBT is an approach that focuses on how clients change rather than diagnosing and treating problems. This requires listening, absorbing questions, and connecting to the client's responses. It is through this process that the therapeutic alliance is strengthened and a sense of unity is established. The practitioner takes the stance of not knowing and of leading from one step behind through solution-focused questioning and responding, enabling a more seamless collaboration between both parties and allowing them to co-construct during this process. Three main elements to SFBT conversations. 1. SFBT conversations are centered on client concerns, who and what are important, a vision of a preference, exceptions, strengths, and resources related to that vision, motivations, and confidence in finding solutions. SF conversations involve a therapeutic process of co-constructing altered or new meanings in clients through questioning. Therapists employ responding and questioning techniques to help clients build a vision for their future by implementing strengths and bringing that vision to life. Goals are key in SFBT. Goals are formulated and amplified through conversations about what clients want different in their future. Clients set the goals. Therapy focuses on exceptions related to goals, regularly scaling how close clients are to their goals or a solution, and co-constructing next steps to reaching those goals. Specific active ingredients. A. Developing a therapeutic alliance. B. Creating a solution versus focusing on those problems. C. Measurable, changeable goals. D. Focusing on future-oriented questions and discussions. Scaling attainment of goals to get clients progress evaluation. Focusing the conversation on exceptions to clients' problems. Most importantly, on what the client wants different, encouraging them to continue the same actions that aided in making those changes occur. Main interventions. A positive collegial solution-focused stance. An important aspect of SFBT is the general tenor and stance taken by the therapist. In this instance, the therapist leads from behind, taking a more cooperative role. Previous solutions have been solved before. Exceptions, something that happened instead of the problem with or without a client's understanding. Questions versus directives or interpretations. Very important part of the process. Present and future focused questions versus past oriented focus. Compliments, validating to promote encouragement. Gentle nudging, encouraging the client to do what works. Specific interventions. Pre-session change. Solution-focused goals. Very clear, concrete, and specific goals that are imperative part of the process. Miracle question. It helps the client come up with similar or smaller, more manageable goals while respecting the enormity of the problem. Scaling questions. This is an imperative part of the process. This is where the client evaluates their own progress from a scale of 1 through 10. Constructing solutions and exceptions. Coping questions. Taking a break and reconvening. This allows for the therapist to collaborate and receive feedback from colleagues. Experience and homework. Homework sometimes designed by the client also is not required for change in this modality. Experiments at the end of the session are optional and they're suggestions for the client. SFBT populations. This modality is helpful for adolescent and adult outpatients with various disorders. It serves as an aid to more serious conditions. It's used in different environments such as education and business, and it's beneficial for those with addiction, abuse, behavior problems, problems with family, and within a relationship. However, there are some limitations in SFBT. It may not be beneficial for the client who is used to being instructed. Therapists may not be allowed to emphasize with the client due to the quick goal-oriented nature. SFBT discards pertinent information that is used in other modalities. And because it is goal-driven, it does not allow for in-depth analysis of the client's past. Therapist requirements. Therapists that are successful in SFBT contain the following characteristics. They're warm, friendly, naturally positive and supportive, open-minded, flexible to change, good listeners, active listeners, tenacious, and patient. Thank you.